Good morning, and thank you very much for listening to my presentation today. My presentation is part of a larger implementation research project that is being implemented in Ghana and the Gambia, but I'm going to focus specifically on the Gambian component. In the Gambia, or can I start by saying that maternal mortality is one of the greatest development indicators between developed and developing countries, and also a significant marker of gender inequality. In the Gambia, although the rate of maternal mortality has declined significantly, it still remains high compared to other African countries. The Gambia has been ranked among the African countries with the highest rate of maternal mortality, estimated at 287 per 100,000 live births. The factors that are contributing to the high rate of maternal mortality in the Gambia are wide-ranging, but they include sociocultural factors and also health service-related factors. These factors interact in different ways to influence the poor maternal health in the country, resulting in adverse maternal health complications such as maternal mortality. Although the factors affecting maternal health in the Gambia have been adequately examined, the studies have pretty much relied on the use of the social determinants of health, which was propounded by the WHO Commission on Social Determinant of Health. So by definition, the social determinant of health explains that our health is influenced to a large extent by the condition in which we live, in which we grow, and also in which we work. So much of the studies that have been conducted on the causes of maternal mortality in the Gambia have utilized the social determinants of health. And if you look at the broader field of gender inequality, intersectionality has become a critical component, a theory or approach that can be used to understand maternal mortality, but that has not been the case in the Gambia. So, the overall aim of my presentation today is to share with you some lessons that we have learned from applying intersectional approaches or lens towards understanding the social determinants of maternal health in the Gambia. I'm going to explain to you how we have applied intersectionality or intersectional thinking in the framing of the research design, such as in the data collection, in the data analysis, but also the implication for applying intersectional lens towards understanding the social determinants of maternal health in the case of the Gambia. So the project that of which this particular presentation forms part of is called the SCIS project. In full, it means Shifting Gender Norms for Improved Maternal and Adolescent Health. That is what we meant by SCIS. The overall goal of the SCIS project is to promote or improve maternal health in the Gambia, but with a specific focus on promoting the active participation of husbands in pregnancy and childbirth, particularly as it relates to birth preparedness and complication readiness. Birth preparedness and complication readiness is a new term that has been developed by the WHO, that if a woman is birth prepared and she is complication ready, she is less likely going to die of maternal or pregnancy-related complication because she is birth prepared and she is complication ready. And men has a big role to play in women's level of birth preparedness and complication readiness. So that is why we wanted to promote maternal health by promoting the active participation of husbands in issues pertaining to birth preparedness and childbirth. So the CIMA project is part of a larger project that has been funded by the IDRC that uses gender transformative approaches to advance sexual, reproductive, maternal health and rights of women and girls in West Africa, or in Africa, with a focus on intersectionality. So we draw on the conceptual framing or thinking of the social determinants of health, but also using intersectional approaches. This was informed by the fact that the factors that are affecting maternal health in the Gambia cannot be looked at from a social determinants of health perspective, but also they can be looked at from an intersectional lens. So it was on the basis of this, and given the complementarity between social determinants of health and intersectional approach, we decided to use these conceptual frameworks to guide the designing, the data collection, and also the implementation process of the project. So the intersectional approach that was adopted by the project also relied on the use of a socio-ecological model. So by definition, the socio-ecological model stipulates that for a gender transformative change to happen, it needs to happen beyond the individual level, but also you need to take into cognition the community level factors, the institutional level factors put together for gender transformative change to happen. So it was on the basis of this that we decided to use the socio-ecological model, but also given the fact that the factors that are perpetuating poor maternal health in the Gambia are deeply rooted in gender sociocultural norms, we adopted the use of gender transformative approach. And also, in a way of complementarity, we made use of a mixed method research design, because I've already highlighted that the factors that are affecting maternal health in the Gambia are intertwined, they're interlinked. And you can't understand the factors by utilizing a single data collection method. So that justifies our use of a mixed method approach in the project. So the socio-ecological model, we use the socio-ecological model, a mixed method research design comprising of survey, a cross-sectional household survey, focus group discussions, and key informant in-depth interviews in the designing of the project. And this allowed us to explore more in-depth the intersections between some of the factors based on the literature review that were found to be major contributing factors of poor maternal health. And one of them is age, another factor is ethnicity, another factor is educational level. So these factors, based on the existing literature, were found to interact and intersect in multiple ways to influence maternal health in the Gambia and maternal mortality. So we use the socio-ecological model, complement this model with a mixed method design to understand the intersection, or to explore the ways and manners in which gender, age, educational level of the husband, of the wife, interact together to affect maternal health, but also to limit the participation of husbands in pregnancy and childbirth. So the use of the gender transformative approach, like I have already underscored, that the factors that are affecting maternal health are deeply rooted in sociocultural norms. There are so many existing gender dynamics at the household level, at the community level, that interact in a rather complicated and complex manner to affect maternal health. And if you want to address or improve maternal health outcome in the Gambia, therefore, you need to adopt a gender transformative approach as well. So, on the basis of this, using the socio-ecological model, the gender transformative approach, we design a gender transformative training that was targeted specifically to promoting and challenging existing gender norms that affects the participation of husbands in pregnancy and childbirth. And we train them on issues related to gender relation, gender norms, men's role in pregnancy and childbirth over a period of 1 month. And after that, we wanted to understand the short-term effect of the training. And we found out that the gender transformative training that was conducted for husbands has contributed to increased participation of them in pregnancy and childbirth. So these findings are currently being considered for publication in the African Journal of Reproductive Health. So the lessons that we have learned from applying intersectional approach or intersectional lens towards understanding the social determinants of maternal health in the Gambia is that using a single method in trying to understand the social determinants of maternal health does not work. You have to have a mixed method because the factors that are affecting maternal health are so complex, they are so interrelated that they cannot best be understood using a single method. So that is what we have learned. But also, we have also learned that using the socio-ecological model may, in a way, help you to understand the intersectional nature of age, ethnicity, educational level affecting maternal health. And this has important implications for policy and practice because remember, at the beginning I said, all the studies that have been conducted, interventions that have been conducted, they were mainly utilizing the social determinants of health with limited understanding of the intersectional factors that are affecting maternal health. Or maybe they also have a narrow focus on looking at the health service factors. Actually, the factors affecting maternal health cannot be best explained using the social determinants of health. So that was the central line of argument in this particular study. So I would like to thank you for having to listen to my presentation. Thank you very much.